The insurance companies have a problem. And I guess maybe they don't have a problem, maybe I have a problem with them, but it's a problem that needs to be looked at, in my opinion. Insurance companies should not be allowed to say who I choose to see as a doctor. If I have, if I have treatment that needs to be done, I should be able to pick who I want to see. And I pay for insurance, and they shouldn't have the final say in terms of who I can see. And I think it needs to be looked at and regulated so it's fair. That's all I'm looking for, is fair and consistent. I would ask the legislators to look into ways that insurance companies have to pay for out-of-network, or do away with the out-of-network. The out-of-network kind of drives me crazy. But look at the individual private practices and figure out something to help the private practices, because in turn it's really helping the clients.
The healthcare industry is in such a state of chaos and change. It's like I feel like a mouse in a maze trying to navigate it. I feel like I should have the choice to choose my physician. I've chosen my dermatologist. I've been attending her practice for so many years. I chose her because of her education. I mean, she's Johns Hopkins educated. She's been on the faculty of William and Mary. She's an absolutely incredibly skilled and dedicated physician. I think that should be my choice. I don't think that I need to be legislated by an insurance company as to which physician is appropriate for me. That should be my choice. It victimizes me. I actually feel victimized by the industry if they're refusing to allow me to continue to see the physician that I've been seeing for so many years. I feel like it's somewhat like if I was going to a car lot and I was applying for a car loan and they told me that I had to buy a certain brand and that the car loan would not cover seat heaters. I don't see the car loan industry having a monopoly like that, and I certainly don't know why the healthcare industry should be practicing a monopoly.
I think the one thing that I admire most about Dr. Brown's practice is that she's offering her patients a choice. They don't have to go where their insurance company orders them to. And she offers her services to insured as well as uninsured, but has decided in the greater best interests of everyone to charge her fees as on a pay-as-you-go basis that are very reasonable, and is offering the alternative that people need, since we nowadays seem to have fewer and fewer choices in the different ventures that we go into. She's offering something new, which is really very old-fashioned and has worked for hundreds, thousands of years. And that's giving people the choice to go to whomever they are comfortable with and not have to be dictated to by insurance company strangers for something so personal as their health care.
What I would like to see, barring a single payer system where the insurance companies simply are not there between me and my doctor, I would like government, if possible, to make it so that my insurance company doesn't make me jump through hoops and wait an extraordinary amount of time to be reimbursed and make me fight for reimbursement from doctors that don't accept insurance. This whole process makes healthcare cost so much more than it needs to.